Today's question: a 28-year-old woman presents with 6-month history of progressive difficulty walking, tingling in her hands and feet, frequent episode of clumsiness. She reports no significant medical history but mentions chronic diarrhea for the past 2 years. On examination, decreased vibration and proprioception in both lower limbs, positive Romberg's test, gait ataxia is present with absent deep tendon reflexes in the lower limbs. There is also muscle weakness in lower limbs with no pallor, jaundice, no skin pigmentation abnormalities. Lab investigation showed hemoglobin of 12.5. Blood smear showed mildly fragmented red cells. Function tests are normal. Stool studies are positive for fat globules. What is the most likely diagnosis? So in this case, there is neurological manifestations with tingling, ataxia. There is positive Romberg's, which indicates a sensory ataxia, and there is deep tendon reflexes are absent in the lower limbs. Decreased vibration and proprioception in both lower limbs, more so like a vitamin B12 deficiency. But here, the lab also showed that vitamin B12 is normal. But with normal B12, also the hemoglobin is normal, with peripheral smell showing mildly fragmented RBCs may indicate the hemolytic anemia. But here there is no anemia. And also in the question, one thing which is highlighted is chronic diarrhea for the past 2 years, which could be a celiac disease, an undiagnosed celiac disease. So in celiac disease, there is malabsorption of chronic fat malabsorption. So the fat soluble vitamins, which are A, D, E, K, could be deficient, and vitamin E can mimic more like a vitamin B12 deficiency. So this is a case of vitamin E deficiency in a setting of chronic fat malabsorption due to underlying undiagnosed celiac disease. So, to differentiate from B12, they have similar neurological symptoms, but usually there is macrocytic anemia and hypersegmented neutrophils in B12 deficiency. And the treatment is high dose oral vitamin E supplementation. And to manage the underlying celiac disease, you have to go for a gluten free diet. So remember, E can mimic more like a B12. So when you have a B12 deficiency like symptoms with normal B12, think of vitamin E deficiency in a setting of celiac disease or fat malabsorption.